Assalamualaikum. My name is Shayarame. My roll number is PP1650205. I am going to discuss the drug Halothane, which is used for general anesthesia. Indication. This medication is an inhalational general anesthetic prescribed for the induction and maintenance of general anesthesia. It decreases abnormal excitement in the brain. It reduces the blood pressure and frequently decreases the pulse rate and depresses respiration. It induces muscle relaxation and reduces pain sensitivity by altering tissue excitability. Adverse effect. These are the adverse effects of halothane. The first one is cardiac effect. Halogenated hydrocarbons are vagomimetic and can cause atropine-sensitive bradycardia. In addition, halothane has the undesirable property of causing cardiac arrhythmias. Number two, malignant hyperthermia. In a very small percentage of susceptible patients, exposure to halogenated hydrocarbon statics or the neuromuscular blockers succinyl choline may induce malignant hyperthermia. A rare life-threatening condition. MH causes a drastic and uncontrolled increase in skeletal muscle oxidation metabolism. Toxicity, extensions of effects on brain, heart, lungs. Drug interactions with additive CNS depression with many agents, especially opioids and sedative hypnotics. Dosing. For adult inhalation induction 2 to 4% volume by volume in mixtures of nitrous oxide. Maintenance should be 0.5 to 2% volume by volume depending on the flow rate used. Antidote. Recently, an intravenous lipid emulsion was reported to act as a novel potential antidote for systemic toxicity due to local aesthetics. We described the application of this lipid emulsion in a 27-year-old patient with generalized seizures and coma due to local aesthetic toxicity. She recovered quickly and was responsive again 10 minutes after the intravenous administration of the lipid emulsion. For patients below 70 kilograms, a rapid 1.5 ml per kg of lean body weight bolus of 20% lipid emulsion followed by a 0.25 ml per kg per minute infusion should start. Dosage adjustments according to age groups. Dosing for pediatric anesthesia inhalation refer to adult dosing. Dosing for renal impairment pediatric, there are no dosage adjustment provided in the manufacturer's label. Dosing for hepatic impairment pediatric, there are no dosage adjustment provided in the manufacturer's label. Dosing for older patients refer to adult dosing. It is decreased in the elderly. Brand name for halothane is FLUOTHANE. Operational use. FLUOTHANE produces moderate muscular relaxation. Muscle relaxants are used as adjuncts in order to maintain lighter levels of anesthesia. FLUOTHANE augments the action of non-depolarizing relaxants and ganglionic blocking agents. FLUOTHANE is a potent uterine relaxant. Irrational use. Halothane is a general inhalation aesthetic used for induction maintenance of general anesthesia. It reduces the blood pressure and frequently it decreases the pulse rate and depresses respiration. It induces muscle relaxation, reduces pain sensitivity by altering tissue excitability. Drug alternatives are the first one isoflurane, second sevoflurane, and enflurane. Uh, Contraindication is not recommended for obstetrical anesthesia except when uterine relaxation is required. Case study. Female 42 years post-operative uterine fibroid for 4 days, fever, pain, abdomen, for 3 days, nausea, vomiting for 2 days, yellow scalera 2 days, constipation 1 day. Chief complaint, halothane induced hepatitis. Subject gender is female, age 42 years, history of uterine fibroid, fever, pain abdomen, nausea, vomiting, yellow scalera, constipation. Subject heavy menses dysmenorrhea for 4 months, progressive enlargement of abdomen for 2 months. On 16 September 2016, she had a surgery of salpingo-oophorectomy. She had taken halothane 1% general anesthesia on 17 September. Uh, Fever, abdominal pain, generalized malaise had occurred. On 18 September, nausea, vomiting. On 19 September, yellow scalera. Object temperature is normal, pulse rate 80 per minute, BP 130 by 6 mmHg, icterus present, pallor present, CBS normal, GIT hepatomegaly. Assessment, reasonable drug even temporal relationship, D challenge response positive. Plan, should be most important aspect of management is avoid repeat exposure within next 3 months. History of unexplained jaundice following halothane use is an absolute contraindication for its further usage. Concern for hepatitis resulted in a dramatic reduction in the use of halothane for adults, and it is replaced by enflurane, isoflurane, and sevoflurane, etc. But caution is for halothane hepatitis patients for further exposure to fluorinated hydrocarbons. Thank you.